COVID-19, and from Remembrance Day yesterday to today, an additional 594 people be diagnosed with COVID-19. And just to put that in perspective, in the last 24 hours, we had 588 people test positive, and there were 12,442 tests that were done in the last 24 hours. So that brings us to 1,130 new cases in the province in the last 2 days, and our total being 20,368 people in British Columbia. And our new cases in the last 2 days, 249 are people in Vancouver Coastal Health Region, 808 are people who reside in the Fraser Health Region, 16 are people in the Vancouver Island Health Region, 34 people in the Interior Health Region, and 23 of the cases are people who reside in the Northern Health Region. We're now up to 5,793 active cases, and we now have 155 people with COVID-19 in hospital, 44 of whom are in critical care or ICU. Sadly, we have an additional 4 people who have died from COVID-19 over the last 2 days, bringing our total number of people who've died from COVID-19 to 288. 3 of those people were in long-term care home, and one of them was an elderly person from the community. As always, when we think about remembrance and we think about the challenges in mourning people who've died from COVID-19 in these times and how challenging it is, and our condolences go to the families who have lost their loved ones, to the care providers who've looked after them, and to our communities who mourn their loss. We have 11,091 people who are on active public health monitoring right now, and 14,089 people who have recovered from COVID-19. In the past 2 days, we've had 6 new healthcare facility outbreaks at the Nanaimo Regional General Hospital here on Vancouver Island, Chartwell Langley Gardens, Peaceport Seniors Village, the Harrison at Elam Village. This is the second, unfortunately, outbreak at that facility, Dania Home and Finnish Manor. And 3 outbreaks have been declared over at Care Life Fleetwood, Hamilton Village Centre, and Mayfair Terrace Retirement Residence. So that leaves 41 active outbreaks in our healthcare system, 35 in long-term care and assisted living, and 6 in acute care, affecting 1,331 people, 764 residents, and 561 staff. So with that update, I'd like to provide you with the information that we give on a periodic basis about the outbreak, our pandemic here in BC, who's being affected, and where, and some insight into where we're seeing cases being transmitted, and some of the data that we're using in public health to understand where we're going with this pandemic in our province. To start with, the geographic distribution of COVID-19 cases by health service delivery area of the case of residents. The residents of the case, so as you know, by convention, we classify people by where they live. That may not be where they were exposed to COVID-19, where people may be exposed at work or in social environments that are different from where they live. However, this is how we do it in Canada and here in British Columbia as well. So on the left-hand side, the cumulative total are cases from January 1st until November 5th. And then the blue graph on the right-hand side reflects the last 2 weeks between October 23rd to November 5th. And as you can see, the pandemic, as we know, has affected every area of the province, but has affected more the areas in the Fraser Health and Vancouver Coastal Health Region, and particularly in the last 2 weeks, that is where we're seeing the intensity of the transmission in the province. The next graph is the geographic distribution by local health area. So this is a more granular local picture of where cases have been seen in British Columbia. And this is cumulative cases from January to the end of October. We first presented this information in September, and because we have smaller numbers at that smaller geographic area, we update this monthly. And so this is available publicly on the BC CDC website at the end of every month. And again, this gives you a sense of where the impact has been most across the province in a much smaller community and municipality level. And again, it reflects that the intensity of transmission really is concentrated, particularly in the last few weeks, in the Fraser and Vancouver Coastal Health region. The next slide provides our weekly profile of COVID-19 cases, and we have had the highest number of cases yet, with 3,121 new cases in the week that ended November 7th. Our median age has come down and stayed in the low to mid 30s. We've had 116 people who have been hospitalized this week. Our percent of cases hospitalized early on in this outbreak or in this pandemic were in the 20% range. It's now down around 6 to 7%. And the median age are people who are considerably older, in their 60s. We have had 7 new deaths in the past week. And 2% overall of people who have contracted COVID-19 have died. And we know that the age is one of the most important factors in terms of the probability that people will have severe illness or die from COVID-19. And the median age of those who have died from COVID-19 is 85. This is, again, our epidemic curve. So this is how we have, where we've seen cases by week since January. And our first wave, if you will, of this pandemic, as you can see, we flattened quite quickly, and it was focused mainly in areas around Vancouver Coastal Health. We now are seeing much more transmission, particularly in the last few weeks in the Fraser Health region, the most populous region in the province, but we have seen dramatic increases in transmission in that area as well as in Vancouver Coastal Health in the last few weeks. And if we look at this by likely source of transmission, so this is the data that we collect from public health with every single case to try and understand how this virus is spreading through our communities and who is at risk. And we are still managing to get most of that information in a relatively fast way. And the vast majority of cases that we can link to a local case or cluster. And I'm going to talk a little bit more about what that means and some of the stories, some of the data that we use to drive the decisions we've made about activities and orders that we have put in place here in British Columbia. I will say that with our rapid increase in numbers of people affected by COVID-19 in the last few weeks, this has been put at jeopardy. Our ability in public health to find everybody in a timely way, particularly in the Fraser Health and Vancouver coastal regions, has been stretched to the max, and we are falling a little bit behind, which is why we put in the measures that we put in, and I'll talk a bit more about that in a minute. If we look at the age group of people who've been affected by COVID-19 in BC, we can see that early on that purple line reflects people 80 years of age and older. And that is because our first part of our pandemic was driven by outbreaks in long-term care homes. More recently, through the summer, we started to see younger people more likely to be infected and to pass it on to others. And that's that dark green line that's at the top. We did have some decrease in that when we put in focus. We put in some orders and focused our activities prior to schools opening in the end of summer. However, recently we started to see young people again driving infection in the province, whether it's through social interactions primarily, whether it's through work interactions. And what we're seeing now is spillover into older age groups where people are more vulnerable. And particularly, we've seen in the last few weeks another dramatic increase in cases in people 80 years of age and older. And once again, we're starting to see spillover into long-term care homes where we know it's an older population that are more likely to have more severe illness. So to dig down a little more into what we're seeing, what exposure settings have made us concerned in public health, and why we are asking people to limit their social interactions, why we put in the orders we put in the last week. So this is just the information that we've gathered by exposure setting by age group since the beginning, middle of September when schools opened. As we have seen all along, the primary source where people are exposed is through their households or community interactions. So these are the social interactions we have, whether it's having people over to our house, having family meetings or family gatherings, whether it's having parties, celebrations, and whether it's in the community when we're connecting with people, our neighbors before our kids' soccer game. We've seen transmission where people have been going to the gym, for example, and all the right measures are being taken at the gym, but they're congregating before or after. We've seen it in hockey arenas. We've seen it at some youth football games. We've seen it with old-timers hockey leagues where the sport itself is fine, but it's the gathering together afterwards. And those are the household and community private party or events. When we put in measures to try and reduce some of the exposure potential in those areas we knew were risky, like at the banquet halls where we were seeing large numbers of people gathering, at nightclubs, which we have shut down, we've now started to see decreases in those areas. And right now, a lot of the focus of transmission in our communities, particularly in the Fraser Health and Vancouver coastal region, is because of our social interactions, whether it's in the community or at our home. And we don't put in place those same measures in our home to keep us safe that we do in other settings. The other thing this shows us is that young people, particularly school-age young people, have very few transmissions or exposure events that lead to cases from schools or daycares. And we do still see in the older age group it's related to healthcare, which again reflects transmission in our long-term care homes. So I want to talk just a minute about some of the other data that we have. So we collect information on people who are healthcare workers. What we don't have in detail, we collect this information, but not in a way that it's easy to pull out and report on, is where the exposures occurred for these healthcare workers. We do know that our healthcare worker rate has come down dramatically from early on when we were testing healthcare workers almost exclusively, and it's less than 10% right now of all of our cases are in people who are healthcare workers. The majority of them work as nurses or care aides, and that's not surprising given that's the highest proportion of workers in our that are in healthcare work. We do have, for example, a number of 83 dental professionals who were involved, and we know that the majority of those were people who acquired their infection attending a conference early on in the pandemic. And as you can see here, there's a variety of other healthcare workers who have been exposed. Most of the exposures are the same as the rest of us. We get exposed in our community through our family, for the people that we have contact with. And we will be providing more detailed data on that as we collect it. So I'm going to walk through a couple of real scenarios to give you an idea of what we're talking about when we say contact tracing, when we talk about what it is that leads to transmission in our communities and the cascade that one infection can cause. So from just one positive COVID-19 employee in an industrial setting, 48 additional people became positive in that work site. One of those people was admitted to hospital. Seven of those people, seven other people became positive after interacting with one of those workers. 46 household contacts were affected. So people went home and their household members had to be isolated. They couldn't go to work, they couldn't go to school because they were close contacts of a case. And there was 111 people who were unable to go anywhere for 2 weeks because of their exposure. Of the 7 people who had interactions with those 48 sick workers, 4 additional work sites were put at risk. One was a car dealership where there is transmission to other staff at the car dealership. One was a medical clinic, a lumber mill, and a processing plant. And this just gives you a sense of one single workplace where somebody unintentionally brought the virus in with them, whether it was because they didn't recognize they had symptoms or they didn't feel they were able to stay home because of the nature of the work they were doing, can affect hundreds of others in our community. And this is how the virus transmits. This is another scenario, which is another one that we have seen happen far too often, particularly in the last few months. In this summer, when people started to feel like we were controlling the virus, we had a lot more social interactions. And this is what happened in one case, where 50 wedding guests were exposed. One person inadvertently brought the virus into a wedding. And yes, there was supposed to be a limit of 50, so 50 additional people were exposed. 15 of those 50 people became positive for COVID-19. And 10 of those people, additional households, where someone tested positive, requiring another 37 people to isolate at home for 2 weeks, not being able to go to work or to school. One person worked at a long-term care home, and an outbreak happened at that long-term care home that required 81 of the residents in that care home to self-isolate in their rooms for 14 days and to be tested and to not have visits from their essential family members. In addition, 3 people were admitted to hospital and 1 person died, tragically. 5 from those 15 guests who were positive, 1 family business was affected, and another 5 employees at that business were tested positive for COVID-19. And as you can see, it just takes one lapse that can have many multiple effects. And this is not just a single story. We have been tracing similar situations, whether it's from weddings, from birthday parties, from baby reveal parties, from celebrations of life. And these have happened all over the province. This is just one example. Finally, I want to talk about another scenario that we have seen repeatedly in small numbers. And so these are the scenarios that give us the sense of what are risky environments. So this was just one person positive at a fitness class. And from that one person, 67 cases at 2 fitness studios were infected with COVID-19. It led to 6 school exposures when family members or people who worked in the school inadvertently went to school at the time when they were potentially infectious to others. 4 people tested positive at a correctional facility, leading to challenges with staffing as 80 additional workers were required to self-isolate and unable to go to work. 3 people were admitted to hospital. 180 positive cases at 2 additional group fitness studios. And 37 more people tested positive after coming in contact with the initial 67 people. And of those, 7 tested positive after 1 person attended a games night. So this just gives you the impact. And it's not that businesses are bad or doing the wrong thing. We are learning from this virus that there are some situations that are much riskier than others. So doing group exercise indoors, and this is something we have come to appreciate with this virus over time, that indoor settings are more risky than outdoor settings. When you're exerting, when you're exercising and breathing heavily, that is more risky than when you're doing quiet exercises or quiet activities, and when you have physical distance between people. The other issues that we see are ventilation issues, indoors versus outdoors. And the fact that in many of these group activities, the music is very loud and there's somebody who's talking very loud to give you the instructions of what to do. And this can very rapidly spread this virus. We've heard about the challenges with aerosolization, and it's the environment that allows that type of spread to happen. And we've come to recognize that the safety plans that we thought were adequate for COVID-19 are not adequate now for this type of activity. And I say now for a couple of reasons. There are things that we could get away with in the summer. Probably because of the seasonality of this virus. We're learning that it doesn't spread as well when temperatures are warmer, when humidity is lower. But as we move into what we call our respiratory season, our cough and flu season, we're finding that this virus as well finds it easier to transmit. Partly because we're indoors more, but also because the weather conditions or the climate conditions make it easier for the virus to spread. And we're seeing that around the world. This is not unique to BC. We're seeing it across this country, we're seeing it in Europe, in all of the Northern Hemisphere, where it's becoming much more challenging. So things that we could do in the summer when we had lower rates of transmission in our community and the virus wasn't as readily able to spread, and we did a lot of things outdoors, we can't do now. We need to pay attention to the fact that we are learning more about this virus, and the safety measures we may have had in place before may not be adequate anymore. And what we're seeing in public health is that's what we are tracing people back to. So we're talking about several hundred people that cascaded out from several small group classes. So these made us realize that what we thought was adequate are not. And that's why we put the order in on the weekend to temporarily stop these classes. The other things that are happening in gyms are happening without transmitting of the virus. So those safety measures are working. But we need everybody to pay attention now, to go back and look at all of the safety measures, your COVID safety plan, whether you work in a food processing business, an office, a car dealership, or a gym. These are the times now to review those plans in the light of the increased transmission in our community and what we are learning about this virus as we go into this season. So what we know is that in the last 2 weeks, we had been seeing a steady increase, but we had been able to manage it. As I was mentioning, with public health contact tracing teams, we were doing a good job of finding people, stopping that next chain of transmission. In the last few weeks, that has become way more challenging, particularly in the Vancouver coastal and Fraser Health regions. And this is reflected again in a dramatic increase in our numbers of hospitalizations and people in ICU in the last 2 weeks. And what we know is that these hospitalizations are primarily focused in the Fraser Health and Vancouver coastal regions. In most of the other parts of the province, we are seeing increases in cases, but not at the level, and they're being able to be managed by public health. I want to put this slide up again because it also reflects important measures that we're looking at. You know, who are the people affected and what are the age groups? So what this shows us in the blue bars on the far right are the percent of the BC population in each age group. Next to that is the hospitalization, or sorry, the cases, the numbers of cases, the percents of cases in that age group, then hospitalizations, ICU, and deaths. And what this shows us again is that under 12, under 10, we are underrepresented. So that even though our testing has increased in that age group, we're still not seeing very many cases in that age group. And the 10 to 19-year age group, we have seen an increase in cases. It's mostly clustered in the older, the 18, 19-year-olds who are more like the young adults. But thankfully, we have very few hospitalizations. We've had nobody who's required ICU care, and thankfully no deaths. Where we see the tragedy is later on. After age 70, the risk goes up dramatically, and most of our deaths have been in people who are in their 80s or 90s, our seniors and our elders. After looking at that, and talk a little bit about school cases, because this is something we've been watching very closely. Most school-age children with symptoms, again, continue not to have COVID-19, which is good news. We know there's been a lot of coughs and runny noses and a lot of children tested. The testing rates have increased 2.5 times since August, and now about 2/3 of the tests are done by the spit and gargle test, which is great. It's a lot easier on young people, and we're now up to about 1.7% of children test positive. So the vast majority still are not carrying COVID. And the school-age children are still less than 10% of our cases. This is just a numerical graph of the number of school exposures, and I just want to remind people that exposure is somebody being in the school environment during their infectious period. We have had very few transmissions within a school setting. So despite the fact that we've had 261 exposures where there's people, whether it's a student, a staff member, an educator in the school setting, that there have been less than a dozen incidences where there's been transmission within the school setting. And we've had one outbreak in a school in the interior health. So what that tells us is that the measures that we have in place, and particularly screening out people who are ill, catching them early, making sure that we're reducing the probability of transmissions in schools, is working. 9 in 10 schools have not had a school exposure event even across the province. And that is important. This has been a focus because we know how essential it is for our children to be in those environments and to try and make them for their education, for their growth, for their development, for their future. And I just want to say again how impressed I am and how important it is that teachers have risen to this occasion, that everybody in the school setting is doing their best to make sure that it continues to be a safe learning environment for all of our children. And these numbers tell us that we're doing a really good job at that. I'm just going to go quickly through some of the case rates. As you know, our rates have been increasing, and this is our daily cases per million population, our 7-day moving average, and it has increased in the last little while. And I notice in the newspapers they've noted that we've surpassed Ontario for the last couple of days. And you know, that is concerning. Everything that I'm talking about has been because we started to see a dramatic increase, particularly in the last couple of weeks, and it's stretching our ability to cope from a public health perspective. But what we see is we're not alone in this. And with the exception of those areas who were very able to wall places off early, where where people moving back and forth is not as common, have been much better able to reduce the risk of transmissions. From an international perspective, here in BC and in Canada, we continue to do relatively well, both in our case rates and in people who have died from COVID-19. And I think that's an important measure as well, looking at what's happening. This is a global pandemic, and we are all learning, and we're all trying to manage what is happening in our own jurisdictions. And I'll put this again, this is cases and deaths in Canada, and with BC, and as you can see, we have done a really good job at trying our best to protect those who are most vulnerable from this disease, but we are at a place that is challenging for us, and we don't want to be here now, but it is our reality, and it's one that we're dealing with along with everybody else around the globe. Our weekly summary of lab testing is up. We're up about 7% from last week, but our positivity has gone up, and that's a couple of things. One is we're testing more people, but we are also focusing on people with symptoms, and our positivity rate is now about 5.4%. Today it was just under 5%. And that is there's a couple of things with that. We worry about test positivity if we're testing large numbers of people and we're seeing high numbers of cases, but we're not, the positivity rates are lower. I'm not making myself clear here, but what we're focused on is making sure that those people who need a test get a test, and our results are showing that that is working here in BC. Having said that, as we go further into respiratory season and we start to see more influenza, we're going to have to manage within our testing capacity, and that means slight changes to who gets a test or who needs a test for COVID-19. Right now, the proportion of our respiratory specimens, so this is the testing rates that we're doing by age group and by week, and the positivity, the percent positivity. And as you can see from this, in every age group, we are increasing our testing. With the exception of the older age groups, it's staying relatively steady. But what we are seeing is an increase in test positivity in each age group, meaning that we are seeing a higher proportion of our population being affected right now, and that is one of the reasons why we need to take a step back, particularly from our social interactions and from our travel. The next slide is an update on our seroprevalence study. So we started this in March. We did another slice of the population in May, and then this is from September. And what this is looking at how many people from community laboratory tests, the blood left over from tests by different age groups, have antibodies for COVID-19. So our seroprevalence is still about 1% here in British Columbia, which means we've done a good job at keeping it low in our province up until September. We're now into a second phase, and we need to take a step back and look at how we can manage to get us through this next few months. So this is our update on the modeling. As you know, we've been using the reproductive number, which is an average of how many people each case transmits to. It's a challenging number because we know that this virus is not transmitted equally by everybody. We know that there's settings, and I described a few of them, where one person can spread to many people. And then there's most people who don't spread to anybody. So it's a balancing of finding out how many clusters we have, and that's all put into the model. But right now, the bottom line is that we are above 1, which means that on average, people are spreading to more than one other person. And when you're above 1, that gives the potential for it to spread quite rapidly. I will note that when I last presented this information, and before the Thanksgiving weekend, we had been dangerously above 1, and we had bent it back down again. Unfortunately, since that time, we've seen a takeoff in the virus in our communities, particularly in some parts of the province. And this is the first time we've broken it down, because we've had enough cases now in the province to be able to do this, to look at Vancouver Coastal, Fraser Health, and the rest of BC. And what we can tell is that the challenge is clearly in the Vancouver Coastal and Fraser Health areas. That's where our highest numbers of cases are, and that's where our modeling shows us that we are above that reproductive rate that we need to be at. But we are not out of the woods in the rest of the province. We have started to see, again, clusters and transmission, particularly people traveling back and forth from the Lower Mainland and from other provinces where transmission may be higher. So this is a cautionary tale to us. We need to start paying attention again to taking those measures that reduce the probability that we're going to spread this virus. Finally, there are dynamic compartmental models. These are ones, again, showing us where, how the progression of this pandemic is happening and potential scenarios for the future. We've added on this today, the doubling time. And what this shows us is our cases per day have doubled in the past few weeks, every 13 days. So that, again, is another measure that tells us we're accelerating the numbers of cases in our community, and we're having challenges breaking those chains of transmission through our case and contact tracing. As much as our staff are working every day and trying to get on those, we're reaching our limits. And that is why we need to take measures now to reduce those transmissions. If we look at it again, broken down by different areas of the province, we see most acutely in Fraser and Vancouver Coastal, but the gradual increase that we're seeing in other parts of this province is important as well. This is our time. We need to take a step back and recognize that we are being affected in the same way that people around the globe are being affected. The things that we could do in the summer when rates were low, when the climate was more favorable, we need to take a step back from now. It's not that people are bad or that businesses aren't doing the right thing. It's the things that we are learning about this virus is that it can now transmit very easily as we're moving indoors, as the weather is changing. And we need to pay attention to that, and we need to adjust and modify our behaviors to account for that. We need to protect those important things in our community, like our businesses, like our hospital and healthcare system, making sure that our healthcare is there for everybody who needs it, whether it's from COVID or from anything else. And we need to protect our schools. That is why we put in place the restrictions that we did this weekend. And the week before that, reducing as a provincial health officer order around the province. What we are seeing is that it's our social interactions that we spread this virus inadvertently to those people we are closest to those people we socialize with, those people we have in our home, or that we go outside, we go to parties with. And those are the people that we need to protect the most. And right now, we're starting to see increase in hospitals. We're starting to see more people in long-term care being affected. And that's our signal. It's time to step back. We have to step back from our social interactions so that we can protect our community's health and wellness in the long term. We're learning that this virus, as I said, transmits much more easily inside. We need to get our social interactions back to those levels where our public health case and contact tracing can control the spread. That is in our hands to do. It's in our hands to keep our schools open, to keep our health system open. We are not trying to get this virus down to zero. We've come to understand that this is a virus that transmits in our community, and it's going to be with us for some time. It's going to be with us through this winter. And we need to find ways to live with it without putting people at risk, particularly our seniors and our elders. We need to put the brakes on COVID-19 transmission. We need to come back to making our wall strong so we can manage and control the spread instead of it controlling us. We are in a challenging time, perhaps the most challenging time of this pandemic. It seems to have been going on forever, but it will end. We do have hope. This is not forever. This week we've heard positive news about vaccines that will be coming available early in the new year, and we are planning every day to make sure that we can get those vaccines to people who need them as quickly as we possibly can. But it's not going to end suddenly. It's going to take us supporting each other for the next several months so that we can find ways to celebrate our past and protect our future, taking care of each other. As vaccine becomes, protect those who are most at risk, and that will allow us to do more. And then eventually we're going to have vaccine that's available for everybody. And that's going to happen next year. But for us to get from here to there, we need to, all of us, take a deep breath, recognize that we can do than we did in the spring, so that fear and uncertainty, we can take a deep by standing together and staying apart, by supporting our communities, by helping out those we know, but doing it virtually. And we need, of course, to remember that we need to be kind to each other. This is not an easy time for any of us. We'll get through this by being calm and being safe and being brave. Thank you.
Thank you very much, Dr. Henry. And just to finish with our presentation, before I do, I wanted to, on behalf of, I know, people in BC and the Premier and everyone else, pass on my condolences to the 4 people who passed away in the last 2 days for COVID-19 in British Columbia, 3 in Vancouver Coastal Health and 1 in Fraser Health. This is an unbelievably difficult time to deal with loss, and today we're dealing with a lot of numbers and statistics, but I think we know and you know that every one of those numbers, whether it's someone who is dealing with COVID-19, whether it's someone self-isolating or someone who's lost a family member or relative, is a person, and we want to pass on our condolences and our thoughts to all of those families, for all the caregivers, for all the family members, for all the friends of the 4 people who have passed away in the last 2 days. I wanted to note, and we saw this in the presentation and in the numbers today, the many people, the 11,091 people who are currently under public health surveillance, 155 people who are hospitalized, and that's up 13 from Tuesday, the 44 in critical care. That's down 2 from Tuesday, but it's still a significant number. The 12,442 tests, to say that our healthcare system, to say the least, is going all out. And that's part of what my part of the presentation will describe, which is making sure that we have the resources in place for these times. In September, I presented, the Premier presented, Dr. Henry presented, Deputy Minister Steve Brown presented our plan for the fall-winter period, knowing that this period was going to be a challenge, knowing, especially as we're going into influenza seasons now, what a potential challenge it was for our healthcare system. And I'll remind you that document, BC Health Sector Plan for Fall-Winter 2021 for the management of COVID-19, which we presented in September 2020, said that from a healthcare perspective, we had public health perspective, we had 3 key areas of ongoing focus: building out our testing capacity for up to 20,000 tests per day for the mid-fall through winter, increase contact tracing and case management capacity by adding an additional 500 initially, 608 after, and now 800 contact tracers over the early part of the fall, and an enhanced fall flu immunization campaign. In addition, we gave presentations around PPE and, of course, around seniors' care and the need to increase both of those, and the extraordinary results from PPE is an indication of the work being done in the last couple of weeks in particular in that part of the healthcare system. In addition, I wanted to show that the healthcare system and prepare for a healthcare system that had adequate physical capacity to meet demand, while knowing that we can successfully implement more extreme hospital access measures if required. That's from page 3. And finally, from page 22, that the Provincial Health Services Authority, working with the Ministry of Health, has completed operational modeling of supply and demand for inpatient critical and medical beds using the following working assumptions. That's on page 22 of the report. The majority of COVID-19 cases will be found in Fraser Health and Vancouver Coastal Health. There will be less cases in Island Health, Interior Health, and Northern Health in acute care. At the moment, there are 2, as you know, and that there would be a series of sequenced proportional responses or lines of defense if the number of cases increase in the fall-winter, rather than a whole of health system response, which we saw in the spring. So I wanted to take you through these slides, and the first one is with respect to contact tracing, and we've been reporting on this every week. Last week we had announced we'd hired 580 people in new positions. We've added to that total this week 56 more, for a total of 636 individuals hired. And in addition, there are further 172 in the offer or interview stage. In addition, we have shifted some of those resources, in particular from the Provincial Health Services Authority to the Fraser Health Authority, to meet the extraordinary demand there. It's our intention to hire incrementally more than 800 contact tracers. It should be, people working in contact tracing, I should say, it should be understood that this is in addition to the hundreds of people, between 500 and 600, who were working in this area before. So that area continues to be very positive, and we are both impressed and gratified by the number of people who have been interested in this, have applied for this, and have become part of our contact tracing team. The second slide has to do with health human resources supporting seniors. We've seen some discussion of this, and we want to say that's the 7,000 healthcare workers we're talking about hiring in long-term care and assisted living to support those sectors. And as I reported on Monday, as of November 9th, approximately 826 FTEs have been hired for the visitation and infection prevention control, which is the first 2,000 of those FTEs, and more than $120 million has been distributed to providers to increase and to hire in those areas. In addition, we've had 8,649 expressions of interest in the Health Career Access Program, and nearly 5,000 of those have gone through their preliminary interview and screening process. And as you can see, that's making significant progress. More than 2,500 of them have gone to the next stage, which is going through the criminal records review stage, and then they're ready to join and be part of that program. So that work is being done, and we've made, I think, exceptional progress in a short period of time. I want to move on to lab services capacity. This is our capacity to test for COVID-19 in BC, and as you can see, it's steadily on the rise as of today. The number of daily tests and capacity in our system is 18,633. This is not, I should say, the number of tests every day. As you can see, that number fluctuates day to day and based on the demand and need. But we know, and you know, that as influenza season develops, there'll be more people with initial symptoms that could be symptoms of COVID-19, and we would expect testing to grow, and we are moving to meet that capacity. We expect shortly to meet the 20,000 that we promised in. And finally, with respect to hospital capacity, just to give you an update on hospital capacity, which is addresses occupancy rate by COVID-19 sites. I've shared some of this information with you on Monday. If you would look to the third column on the right, what it shows is our total occupancy rate by health authority at the moment. At the moment, when combining our vacant base beds and surge beds, there are 2,185 vacant beds that we are able to access overall in the healthcare system, and you can see it differs by health authority. Again, we are obviously making more adjustments, in particular right now because of demand in the Fraser Health and Vancouver Coastal Health Authorities, where 153 of the 155 hospitalized people are. And the next page is critical care, and you'll see again our total occupancy rate in critical care is 51.1%. This is our current base beds plus our surge beds, and you'll see that there's 375 vacant base and surge critical care beds across our hospitals. And what, again, that shows is that we have the capacity to meet demand, but as hospitalization of COVID-19 increases, it will continue to affect obviously our hospitals, particularly in those areas where the largest concentration of COVID-19 patients are, and that will affect our ability to deliver on other healthcare needs, and why it is so important to follow Dr. Henry's guidance and flatten the curve. I want to talk about the surgical update as well, which we do every Thursday, and which is part of this, because this is like keeping schools open, like keeping essential businesses open, like all of our other goals in the system, is critically important for all those patients who need care. As noted, you'll see by health authorities on this slide that health authorities resumed non-urgent surgeries on May 18th and have completed a combined total of 159,634 surgeries as of November 8, 2020. Of which 124,078 were urgent and non-urgent scheduled surgeries, so they're sometimes called elective surgeries, and 35,556 were unscheduled or emergency surgeries. And on the next page, it's very small, you'll see what we've been doing week to week in terms of our weekly surgical updates. You'll see that for November 2nd to 8th, for example, the number is 6,978, and it's consistently in the weeks where we haven't had statutory holidays been over 7,000. I would expect this week's total to go over 7,000 when the final numbers come in and are confirmed, as they are consistently. I think what this shows is a healthcare system and surgeons and nurses and healthcare workers and health sciences professionals working to an extraordinary degree to reduce wait times for people for essential surgeries. And all of these surgeries, of course, are essential for the people that need them. And I think this performance right here is both an example of all that we have done together and what we've achieved together, which is extraordinary, but also shows why it is so necessary to flatten the curve of COVID-19. Finally, I just wanted to give you an update on influenza vaccine, as some questions were asked on Monday about this. And this is a comparison of last year. So total doses last year as of November 1st, 2019. There's just a small mistake here. I think, I'm not sure if it's in the thing. Yes, it is. So the first slide is November 1st, 2019. And the second column is November 1st, 2020. You'll see at this time last year, the total doses distributed in all places, public health, pharmacies, etc., was 1,064,320. The total doses distributed across the province through health authorities, 1,851,130 this year. In addition, we have the remaining doses both in reserve and also are purchasing even more doses than that. So that's 271,600 additional doses will be purchased. I might note that that is overall will be a 47% increase on last year, and I want to express my appreciation to pharmacists, to doctors, to public health across BC who are delivering, as we have spoken compared to last year, hundreds of thousands more doses of influenza vaccine, something that is an extraordinary achievement in a time of pandemic. So I want to say in closing what's obvious to everybody. Since Dr. Henry announced new public health orders on Saturday, we've had lots of questions. We've answered lots of questions about what they are and what they mean for people. But I think at its core, this is a time, particularly in Metro Vancouver, but you see in the data everywhere across BC, because we have high levels relative to where we've been of active cases in interior health, high levels relative to where we've been in northern health, and on Vancouver Island as well, compared to where we've been at least in the recent past, and even in March and April. We know this is the time to take no chances, to give COVID-19 no room to grow. So if you're unsure about something, this is the time not to do it. Unsure if you should do something, then stop. Right now, you need to take no chances. This is something that we can do together, and the importance of doing it now is underlined by the presentation just given by Dr. Henry. I strongly encourage everyone to consider, reflect on their behavior and all of the things we all can do, as we're all part of this, to reduce transmission. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour deux périodes de référence de 24 heures chacune, soit celle des 10 et 11 novembre et celle du 11 jusqu'au 12 novembre en mi-journée. Il y a eu 4 décès liés au COVID-19 durant ces deux périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 288 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. il y a parmi l'ensemble des cas confirmés de COVID-19, 155 personnes sont actuellement hospitalisées. Ça c'est un record pour la Colombie-Britannique. Donc 44 en soins intensifs. Les autres personnes dont le test de dépistage était positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question this afternoon is from Bon Palmer, Vancouver Sun.
Good afternoon, Dr. Henry and Minister Dix. And look, thanks very much for this material you've reached today. It helps a lot in understanding what's going on. I have a question about slide number 6. And the right hand, you refer phase 3B, September the 13th, to current. In order to understand what's been going on, is it, in shorthand terms, reasonable to see that September the 13th data from then on as the second wave? And if so, when would you expect to see the curves on the right hand bend as a result of the measures you announced on October the 26th and November the 7th?
Sure, and that's a really good question. What we've called these phases is around the different testing strategies that we've had. So phase 3B really refers to when we modified the testing strategy for students in the school setting, where we said that that having a single symptom in a child doesn't necessarily mean that they need to go for testing. So that's our epidemiologic way of classifying these phases. I really feel that, as I said, our second wave, we had a gradual increase over late August into September, and really it was controllable. We were on top of it from a public health perspective. So I'm not sure waves are the right way to describe this, and I've said that before, but we did have this gradual increase that we were managing. Where my concern has come has really been in the last 2 weeks, really since the Thanksgiving weekend, I guess. So the impact of the Thanksgiving weekend, we started to see a week later some rapidly increasing rates, and this is reflected in what we call epidemiologic week 42, 43, 44. So it really has been the last 2 to 3 weeks where I would say we're in a place where we needed to take additional measures because we're starting to lose control of our ability to manage every case in a timely way. And so this means that people may be getting notifications. We now have a much faster way of texting people if their test comes back positive. And the importance for people who meet the testing criteria and have symptoms that could be COVID, that you must self-isolate until you get your test results back. And we're getting those test results back to people quickly, but that also means that it may take a day or 24 to 48 hours before public health gets that information and follows up with you. We're at that point right now where we all need to take a bit of responsibility for bending this curve back down, and we in public health are doing our best to try and support you in doing that. So yes, we need to take action now. I don't expect, what we're seeing today and yesterday, numbers that make me slightly anxious, those reflect exposures that happened a week ago. So I don't expect to see much change until maybe Monday, Tuesday, into next week. That's when we're going to start to see if we are taking the steps that we need to bend that curve back down.
Do you have a follow-up, Bon?
Yeah, I'm wondering on a more philosophical basis, do you think that the British Columbia's slow response, slow willingness to listen to what you've been saying for weeks, is one of the factors in all that we had this notion here that we were doing so much better than everywhere else, that it's taken us a while to notice that the trend lines are headed in the wrong way? And I don't mean your office, I mean just the general British Columbia public.
It's hard to know. I think we were able to do a lot this past summer, and I look at across the country, I look at other countries, Italy, Sweden. We all felt that we we had the ability to manage, but if nothing else, this reminds us that humility is important in dealing with this. We're learning new things about this virus all the time. We know some things that absolutely do work, but you know, the fact that it is rapidly taking off at this time of year in the Northern Hemisphere around the world reflects a couple of things. One, that it is circulating in our community, and there's a number of things that we were doing that are no longer as effective as they need to be as rates go up. And the weather, the climate, the cold, the conditions, we have more evidence that's coming out of labs as well as natural experiments around the world that it is transmitted more easily at this time of year. There's a seasonality to it that is unfortunate, but we have to live with that. And that means that we need to take a step back and put in additional safety measures and go back to retreating a little bit in terms of particularly our social interactions. I mean, I will say those places, some settings are still working really well. When we have appropriate precautions in place and people are taking them and using them, and you know, that's one of the reasons why I have been emphasizing now how much more important it is now that we have higher rates and we're in this season to add that extra layer of protection, that, you know, the Swiss cheese model, and we've been talking about how to but each layer does its bit. And right now, wearing a mask when we're in public places, when we're around people we don't know, that's incredibly important, is that extra layer of protection, because we don't know everything about this virus yet, and you know, every day we're learning more.
Next question is from Shannon Patterson, CTV.
What these slides are showing us. Realistically, what are the chances that these new orders you brought in on Saturday will actually be lifted on November 23rd and we will go back to the way it was? Or should British Columbians prepare for the extension of these restrictions or possibly even more?
Yeah, what we are going to do is watch the impact, and it may be that there are other scenarios or settings that show as being risky. So there is possibilities that we will need to do more or different things. There's also the possibility that we will go back to where we were, which is, remember, in the rest of the province, we are having your social interactions include your Safe 6. So, you know, that is our hope, that we can do a circuit break, that we can get the numbers back down to a place where we can manage again, and we can target those places where we're seeing spread and clusters. As I mentioned, you know, this is not a virus. It's not like influenza where we see it sort of move through everybody. It's sporadic. Most people don't transmit, or they transmit to one other person, usually somebody in their family, or that they have a close relationship with when they're spending time together indoors. So, but some people spread it to a lot of people. So we are also looking at things like our COVID safety plans. We know that they work, but there's been slippage. We know that when restaurants aren't paying attention to people mixing and gathering, we can have exposures, and that can lead to transmission. We know in businesses, we've known food processing businesses are risky. They're essential businesses. We need to keep them open. We need to keep people working safely. So we've increased our focus on making sure people have the ability to stay home when they're not well, that they get the testing they need rapidly, that we have those barriers in place, we have masks in place when needed, we have the work site managed so that people are able to work safely. And we know there's so many more essential businesses, but part of the focus that we have on the orders and on what's going on right now, particularly in Fraser and Vancouver Coastal, is stepping up those review of the safety plans in the higher risk businesses where we're seeing transmission. And for everybody, it's important to pay attention to, you know, I've had questions like, can I have a staff meeting with 12 people? I mean, it amazes me that people are asking me that now, because this has been in place for a long time. Sure, if you have a really big room and people can stay far apart, you can have 12 people. But why do you need to have 12 people in a room together? You know, you need to think about making sure that your business has a COVID safety plan that allows people to maintain their distances. And for many, that will be the ability to work remotely, have staff meetings remotely, have so that you're not bringing people into an enclosed space together with other people and their contacts and bringing that risk with them. So those are the types of things we need to pay attention to ongoing. Right now, the focus is on reviewing those safety plans for every business. For some, we're going to have to add extra additional precautions because we're learning that there are environments where this virus is taking off. And for right now, the 2-week period, stepping back our social interactions, particularly in the Lower Mainland, not having that visit from grandparents or family in our house right now, postponing that visit. And yes, I do think if we get things down to a reasonable level, we can start introducing those social interactions in a more measured and safe way again.
Do you have a follow-up, Shannon?
Yeah, this question is for Minister Dix. We're now at the same number of hospitalizations we were in early April when the convention center was equipped as a makeshift hospital. At what number of hospitalizations will you activate that site and other backup hospitals?
Well, I don't think that would be the first step. Remember, and I'll just remind you to refer to the slide, which I'll attempt to find right now. But that slide around hospital capacity showed that we have, as of now, and that's as of this week, as of November 9th, significant capacity. None of these numbers include sites such as the convention center and other sites we've identified for even further surge capacity. So if you look at what we have in terms of beds right now, I think it's a very significant number by health authorities. We have 520 in Fraser Health, 355 in Interior Health, 158 in Northern Health, 102 in PHSA, 875 in Vancouver Coastal Health, and 175 in Vancouver Island Health, and indeed in critical care, a very significant capacity in terms of base beds and surge beds to deal with what we're dealing with. But it does profoundly affect anyone in a hospital will tell you this. COVID-19 profoundly affects one's capacity to do everything in the hospital. It lengthens the time that each surgery takes, and that's why it's so extraordinary that we've done 7,000 surgeries. So those facilities we've kept. Our access to the convention center as a just-in-case effort, but we're not near that right now. But what I would say is that we haven't also either seen the beginning of cold and flu season, which has an effect on hospitalizations. If you recall the September 2020 presentation we made about various scenarios with respect to hospitalization. So this is a significant moment, and that's why I think it's so important that we reduce, that we take the steps and follow the guidance and the public health orders of Dr. Henry. And finally, just to say that 155 people are 155 people. They're individuals, and that's too many to have in hospital from COVID-19, and we want to see that number reduced because every one of those persons has a story and people that love them, and we want to deal with that. So with respect to the convention center, it's there. Other sites in other health authorities are potentially there, but with only 2 COVID-19 cases in the other 3 health authorities, we're not really affected by that in those cases. But those aren't part of the numbers we delivered today. Those are incremental to that, those hundreds, several hundred beds at Vancouver Coastal and Fraser Health sites. In the spring, as you recall, when we presented, we prepared for scenarios based on what had happened in Wuhan and what had happened in Italy, and that didn't come to pass. But we have presented detailed plans and prepared detailed planning for the fall. And even though those beds are there, we don't expect at this time, certainly, to even consider using them.
Next question is from Richard Zisman, Global News.
Dr. Henry, should British Columbians have any hope now that there will be any semblance of a normal Christmas, that they'll be able to gather as a family at Christmas time, they'll be able to visit with Santa Claus, they'll be able to shop? Like, is there any hope of this at this point?
You know, I think there's hope. There's hope that, yes, we will have Christmas. We will have Christmas. It'll look different. And yes, we're going to have to pay attention to things. There's not going to be a vaccine here that's going to save the day by Christmas. There's no one thing that we can do that's going to make this all go away. But there are many small things that we can do that will get us through this and help us celebrate things like Christmas. We know Diwali's coming up. It's a really important celebration for many people in BC next week. We can find ways to do this, and we know we can do that. We can find ways to do this safely that's going to protect the elders in our family. And yes, we can see them, but we can't be together in the same way. And it will depend a lot about what's happening in our community, how much spread we're seeing. But we can find ways to celebrate, to have family, to come together in a way that's safe for everybody. And I think Santa probably has immunity, and we'll look at how we can facilitate him. I think he'll be washing his hands a lot, and he probably won't be eating cookies and milk in every house this year. But we'll find ways of making it work.
And just, I'd say, Richard, yesterday we had an incredibly significant day in BC and in Canada and the world, Remembrance Day. And all I can say is, on Remembrance Day, my friend Ann and I left our apartment. We stood outside in Gaston Park. We listened to on a mobile to the ceremony downtown, and we just stood there, and we were there in that moment. And across the park there was a family that was doing the same thing. And I can tell you, I've been to Remembrance Day ceremonies at South Memorial Park since the beginning, since for about 25 years, I think. And you know, as moving as those ceremonies always are, this was moving. We're going to have to learn to celebrate in different ways. I really want to emphasize that with respect to Diwali and Christmas and New Year's and Hanukkah and all the events coming up. That it's not; these are not events to be celebrated with people in common rooms of apartments and condominiums. We have to celebrate differently this year, but that doesn't mean that the enormous significance of these events for people, either sometimes in a religious sense, sometimes in a cultural sense, that we can't do it in new ways this year that are equally moving and significant. But what we cannot do, what we can't do for Diwali, what we can't do for Christmas, is allow the events we do to celebrate those events to lead to more transmission of COVID-19. So every single person, I'm asking every single person to reflect on ways that we can make this the best Diwali, the best Christmas, the best New Year's, the best Hanukkah, the best whichever day is of significance to you, without coming together in the ways we have before, but appreciating what these events can mean to us in our lives.
Richard, do you have a follow-up?
On the orders that were put in place on Saturday, one of them is around sports, and I'm talking about the team indoor sports. Is there any sense of how much transmission of the virus have happened in that situation? And what are you saying to people who are struggling, in some cases with the borders in Metro Vancouver? Someone may live in Vancouver and play in Burnaby. It may be a 5-minute drive from their house, but they can't go to a practice with their teammates. The same in Richmond and Delta. You know, what do you say about those sort of situations, and why define the travel by the regional health authority and not city or something broader?
Yeah, so we recognize that people live and work in many different parts of the health authorities, and that's why one of the reasons why we're seeing the transmission that we're seeing around both, and we do know that people travel back and forth with those. What we're saying is for this 2 weeks to take a step back and pause. We know that we bring risk with us from where we come, and we bring it back from us from where we go. And right now, moving in and out of the whole lower mainland is something we don't want people to do. We want you to take a step back from that. But yes, you can go within the region. But again, you know, if you have a choice, don't do it right now. Don't do it right now. And that's the same for contact sports. We had seen transmission, and it's very hard to know. if it is from the teams, or the challenge that we're seeing is that particularly in the indoor settings, we're seeing people get together before and after, and spectators getting together, parents getting together, waiting for their kids. So those things need to stop. So what we've done is asked in the Lower Mainland, or directed in the Lower Mainland, that we take a step back from team sports and go back to what we had as stage 2 with the sports reopening, where teams are together, maintaining distance and doing drills and practices rather than having games and skirmishes with each other. That's time limited, and those are one of the things that if we can break this chain of cycle, we can start getting back to again. But it's to focus people's attention on not just the sport, although that is part of it, but it's when we move around and we are coming together before and after games. Part of the reason that I put the restrictions on travel to play sports in different regions of the province is because that involves often carpooling with groups of people that may or may not be in the same cohort or bubble or household. And that, again, we've seen transmission being spread to other parts of the province through that type of activity. And quite frankly, there's been teams coming from other provinces where we have seen transmission. So that's the rationale for it. Outdoor sports, we know, are less risky. But again, I want people to pay attention. We don't need a lot of spectators, and if you do have some, let the kids go. I think it's incredibly important that we keep that physical activity available for kids, and that's one of the reasons why we didn't just say stop all this, but make choices right now. You don't need to be there for every practice. The coaches and the teams can maintain those distances, make sure they're not sharing water bottles and on the bench together, and keep your distances. This is a time-limited thing, but it's important. Those are areas where we're still seeing too much transmission, and that's the reason for the orders right now. Those are ones where, if we get this under control, we can get back to gradually safer redoing those types of activities. I want to say the same for, the dance studios and gymnastics studios and those places, the indoor group settings. Some people have had really good safety plans, but what we've seen is we're learning more about the virus, and it's not about people not doing the right thing. It's about the fact that we need to relook at these and readjust with what we're learning about those viruses. And we know those are important activities, so we are committed to putting in the new guidance as quickly as we can so we can get those activities safely back going again too.
Zhao Zhu, Global Mail.
Dr. Henry, I want to ask that the CDC updated its messaging on masks this week, saying that the benefits come from both source control and personal protection. Does the evolving science on masks persuade you to consider a stronger stand on wearing them? Thank you.
Thank you. Yes, and we've been watching that very carefully. Particularly, we've had some discussion nationally about what type of mask to wear, and as I mentioned earlier, it is more important as one of those measures as we're seeing increasing transmission in our communities, and as we're approaching in the winter or the cold and flu season. So yes, we have said that the expectation now is that people will wear masks on indoor public places, whether that's a building, a shopping, retail outlet, whether it is going into, we've been doing it here in the legislature, and going into the office, in common areas, in public areas, on transit. And I know that people are hearing that message. People are recognizing that masks is an additional layer. It doesn't mean you can't do, that you don't need to do those other things. And that's what's so important. We've never mandated that you have to keep a physical distance, but we know people understand that. And the masking is the same concept. It's an additional measure, very important right now. It protects you, but more importantly, it shows that you're part of this and it protects others around you.
Do you have a follow-up?
Yeah, I just want to ask, so some jurisdictions across the country have issued province-wide mask mandates. So will BC consider that, or?
No, we have always said that these individual measures are ones that we expect people to do, and we've seen that that is the way that people have responded to that. We know that people, there are some people who are not able to wear masks, and we need to respect that, but most people can and do. And this is really important as we're moving into this season, that we continue to pay attention to that, to wear masks in indoor public spaces.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. I wanted to ask you about how the modeling today that you have shared with us, how are we supposed to make that impact our lives over the next few weeks and months? Because we've repeatedly been warned that this was coming, that behavior needed to change, and the behavior has not improved as far as we've seen.
Yeah, I wouldn't say that behavior has not improved. What we saw was a decreasing in our curve, and then in the last couple of weeks, a rapid increase. So this is a visual representation of that. We've been following this from the very beginning, and we know that we can make a difference. So behavior has started to change. We've started to see, and I talked to the people who work on the front lines in contact tracing, and the settings that we're seeing the cases are ones that were social interactions last week. So we're now starting to see new cases having different issues. So, we're monitoring that. What's happening right now is a reflection of the last week to 10 days. What will tell us is what we're going to be seeing next week. It's a very challenging thing with this virus, with a 2-week incubation period. We're always a little bit playing catch up, but I want people to see today that this is not just in one area. This is across the province, but we know we can make a difference. And what we've given is direction about how to do that.
Do you have a follow-up, Marcella?
I do, just regarding following up to that particular statement, how much do you wish that you had implemented these orders sooner, considering that you said it was as far back as Thanksgiving that you believe this latest wave started, if you don't want to call it a wave? And again, with mandatory masks, I'm hearing from business owners who are saying that if we don't make it mandatory, people come into my shop or into my restaurant or into my store and say, Bonnie tells me I don't have to wear one, so you can't force me to. How do you reconcile that with people that want you to, for the sake of their business, mandate masks?
I will say that businesses themselves can say, in my business, it is people need to wear a mask to come in here, and staff need to wear a mask to come in here. And if people don't want to do that, you need to accommodate them by allowing them to order online, by giving them other options. And I will say that to people. If you do not want to wear a mask, if you don't have any reason why you cannot wear a mask, and for people who can't wear a mask, we need to look at alternatives so that you are protected when you're going out. And that means ordering online, doing pickup, not putting yourselves in situations when you're in contact with others. And this is something that, people say, believe me, I get as many on one side as the other. Mandating masks is not something that is going to change some people's minds. We know that most people will do the right thing when they understand the rationale behind it, and we're seeing that. And I would encourage particularly some of the larger businesses, this needs to be part of your safety protocols, and that's more enforceable than my telling people that it's an order that you wear a mask. I will say it's the expectation that when you're in an indoor public place, you wear a mask. And that is across this province. And I know, for example, it was made mandatory on transit, and that has increased mask use. People recognize that it's an important issue right now. It's not a silver bullet that's going to stop all of this transmission. It is one in the layers that we need to take.
Brenna Owen, Canadian Press.
I'm just wondering, Dr. Henry, if you could remind me of what's happening in terms of rapid testing in BC. I'm seeing that Ottawa is sending some rapid tests out to provinces, and whether we've received any.
Yeah, we did receive some of the ID Now machines and a number of the tests that go with the machine. So it's a proprietary swab, nasopharyngeal swab. They're being validated at the BC CDC lab right now. We also received our first shipment of the laminar flow tests as well, the antigen tests, and we're looking at where the best use of those is. The challenges we have are that they're not as sensitive, so they don't pick up certain things, but we do know that they can play an important role in places like where we have a cluster of people with an illness and we need to rapidly determine if it is COVID or not. So if several people are tested and they're all negative, that's reassuring. If one of them's positive, that tells you that this is probably an outbreak that you're dealing with. So we're looking at the protocols for that, similar to what we do with influenza testing, particularly in more remote communities. So yes, we are starting to use these. One of the things that we're finding that's a challenge is they're not, they have to be in a certain temperature. They don't like the cold either. So we had some challenges using the tests. We were using them in some areas in the downtown east side because we know that sending a test to the lab and finding a person a couple of days later can be a challenge, but the tests weren't performing very well. So the lab team is still working about where and how we can best use them. And because they have to be a nasopharyngeal swab, you need a healthcare worker to take the test. So we're still looking at what's the best strategy for how to make sure we have them in the places where they'll do the most use.
Do you have a follow-up, Brenna?
That's pretty much it. I'm wondering if you know off the top of your head how many of these tests BC is set to receive from Ottawa.
I know it's tens of thousands of, I will have to get you the numbers. I do have the numbers, I just don't have them off the top of my head. I think it was 100 and some machines that we received in the last 2 weeks.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about regional orders, visit gov.bc.ca/regional restrictions. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Zara Premji, CBC.
Hi, Dr. Henry. So the CDC, actually I'm going to change my question. At their current trajectory, Alberta's chief medical officer says ICUs in the province would be at 400% capacity for Christmas. So now where do you see BC going if we continue the way we are right now?
Yeah, so